This morning, we're getting an inside look at a new book that aims to help people struggling with mental health. It blends the advice of experts with real stories from real people across the country. 1 in 5 adults in the U.S. experiences mental illness, according to the advocacy group, the National Alliance on Mental Health, or NAMI. And 1 in 20 adults experiences serious mental illness. You are not alone. The NAMI Guide to Navigating Mental Health is by Dr. Ken Duckworth, NAMI's chief medical officer. He spoke with about 130 people about their mental health journeys for the book, and he joins us now. Good morning. You said that you wrote this book because it was a book you needed growing up.
Michelle, my dad had very bad bipolar disorder and was a wonderful human being, playful, loving, charismatic. But my family couldn't talk about it. I became a psychiatrist. That's how far I took this problem, to make sense of it. I wasn't like the science whiz or, anything like that. I did it because I loved him, and I wanted to know how could I help him. Fortunately, I found NAMI over time, which is a whole group of people who want to help each other and teach each other. So this was the book that I needed, a practical book. I wanted to learn from real people. How did you manage your mental health condition? How did your family learn to talk to each other about it? Because my family never quite figured that out. So that's the genesis of this book. I became a psychiatrist, and I still didn't see this book.
You talked to, I think it's 130 people over several dozen different states. What kind of takeaways did you hear from how those families dealt with mental illness in their midst?
There's a lot of wisdom in people who've lived with things that we have not tapped. Everybody knows there's a mental health crisis, and everybody knows there's not enough mental health professionals. Well, it takes 8 years to make a social worker. Why don't we learn from people who are living with these conditions? They have developed wisdom in their families and in their own experience. It was a beautiful experience. I wish you all could have sat through these Zoom calls with people all across the country from 38 states. They share what did they take away from their mental health experience.
Everybody wants to talk about solutions, and one solution is to find someone you can work with, talk to, go to a professional. But there's one solution involving paper plates, which I love, which actually is a solution for me in my life. Could you tell that story?
It's a woman named Catherine who I came upon. She's from Rhode Island, and she discussed going to a peer support meeting, other people with mental health conditions, and she says, my life is overwhelming. I have young children, and I can't manage my life. I can't manage it. And she said, a woman in my group said something to me that had never occurred to me, 2 words that changed my life: paper plates. And she said, paper plates made the difference between me being able to raise my family while living with a mental health condition. I couldn't run a kitchen. And you give up on the kitchen and you love your kids.
Right.
So Catherine's story is one of the many beautiful stories I came
Great
across.
one. So true. Definitely true in my household.
The heck with the dishwasher.
Let's speaking my language right now. You mentioned how growing up your family didn't talk about mental illness. And I believe that is a large majority of this country and around the world. What do you say to those people who don't necessarily have the words to approach someone that's in their family, someone that they love, and it's just a dark cloud hanging over them?
I asked some of America's best research experts to complement these lived experience experts that we just talked about. The paper plates woman is a lived experience. I asked the man who invented motivational interviewing. This is a strategy of how to talk to someone without saying, Nate, I think you need help. And then you say, no, Ken, I don't. End of conversation. The idea is I listen very carefully for what you are actually worried about, Nate, and then I try to come alongside and support you.
Right.
He's one of the 35 experts in the back of the book answering common questions that I get, which is, how do I talk to somebody in my family who doesn't want help? And that's one of the questions that I get asked, and so...
culture is so important. I just happened to see Death of a Salesman last night, and for the first time, this new rendering gave me an understanding what this play was really about. And so culture has a lot to do with how it sort of, frames this message. How would you tell people, or what does it look like beyond that?
On the culture piece, I interviewed people who self-identified. They told me who they were, 11 different races and ethnicities. And what you find is there's a lot of commonality. A woman who grows up in Japan is told, we suck it up. The next day, I interviewed a woman who grew up in Austria, and she told, we were told never to speak about this. And I thought the Japanese culture and the Austrian culture wouldn't appear to be similar.
Right.
But they are.
They
But
are.
apparently, on the mental health dimension, many cultures have come to the conclusion that something that is common
All right.
and costs lives.
Out of sight,
Silent-
out of mind for a lot.
Out of sight, out of mind. Isolation kills people
Yeah.
in the mental health and addiction space.
Well, it's
this book is designed to find people just like you.
Important for us to talk about and bring it out into the open. Dr. Ken Duckworth, we thank you.
Thank you.
Thank you.
You Are Not Alone is available today.